I'm Anthony Nguyen. Join us as we change the narrative around aged care, one story at a time. Welcome back to the Pioneers in Aged Care podcast. Here we have Belinda Sutherland, the General Manager, Health and Wellbeing at Wesley Mission, Queensland.
Hi.
Welcome, Belinda.
Thank you. Thanks for having me.
No worries at all, and thank you so much for being on the podcast. Yeah. We're here today at the Positive Aging Summit in Adelaide, the inaugural Positive Aging Summit event, and we're interviewing everyone about the importance of reablement. So this will have a reablement theme. But before we get into it, I want to say a quick thank you to the sponsors for the episode. The sponsors are Aurelia Legal, an immigration law firm focusing on the aged care sector, specializing in navigating 482 and 186 visa sponsorships. And Optimum Allied Health, a provider of choice for residential aged care facilities, focused on the quality of clinical care in their physiotherapy and allied health programs. And finally, a huge thank you to Mark Ryu at the Australian Aging Agenda for choosing me as their content partner and reablement ambassador and providing the venue in which this podcast is taking place. So thanks to them.
Exciting.
Cool. So let's get into, firstly, give us an overview as to Wesley Mission Queensland.
Yeah.
And we'll start from there.
Yeah. So we're a not-for-profit human services organisation in southeast Queensland. We have a range of different human services, not only aged care. We have living well services, which are for the youth, homeless, inclusive communities space. Then we have aging well. We have retirement living, residential aged care and community aged care, including home care packages and Commonwealth home support, and of course allied health. Mm-hmm. And then we have a range of clinical services. So allied health services. We also run Queensland's only children's palliative care hospice called Hummingbird House. And then we have two other palliative care hospices as well, mental health services and disability services. So we have over 4,000 employees at Wesley Mission Queensland. Yeah. It's a really big organisation, but ageing well is definitely the core of what we do. Yeah. And we have 13 residential aged care facilities within the southeast Queensland corner.
Yeah, right. And I think you mentioned home care as well, was it?
Yep. And we also have 2 retirement living. So all of our Aging Well campuses, it's an integrated campus approach where we have residential aged care, retirement living and our clinical services based in the one location. Our 2 main campuses are Cinnamon Village and Chermside in Brisbane. And that enables us to really embed our integrated care approach so that people can genuinely age well and age in place.
And tell me about your role at Wesley Mission Queensland.
My business unit is Health and Wellbeing, which is allied health at Wesley Mission Queensland. I have over 8 disciplines within my team. I have over 100 staff across 2 wellbeing centres. We provide integrated care into all of our residential aged care facilities. We support our home care package clients. We have Commonwealth home support clients. And then we have healthy living and fee-for-service clients who want to manage their chronic diseases and stay fit and well.
What's your professional background?
I'm an occupational therapist by background, but we have physios, OTs, EPs, dietitians, speech pathologists, allied health assistants, and I've missed something, one of them, a podiatrist. That's it. Who could forget the podiatrist? So, it's really unique. I think my team's really unique for a couple of reasons. We have a really excellent breadth of multidisciplinary care team members, and that's a real privilege to be able to lead that because I think that brings great opportunity. We also have a really well-embedded allied health assistant model, so that's really great for delegated care. And also the fact that we do provide that continuum of care right across aged care. Not many allied health operations get to do from right from healthy living through to that residential aged care spectrum, so an end-of-life process. So I think there's so much opportunity in this team because particularly with the reforms, to really get that pathway of support right. We've just heard from Bolton Clark this morning, the COO, who talked about, wellness and reablement can be across the whole, lifespan for an 80-year-old with dementia or a 50-year-old very active senior who's living in a retirement living village. And my team get to work across that whole spectrum, which is a real privilege.
And tell me, what does your business unit do to promote reablement?
Well, a lot. We definitely have launched a range of new initiatives this year, but obviously one of the things we've focused on this year is increasing our offerings, particularly to that 50 to 65-year-old cohort, particularly because we do see allied health as being a great entry point into good ageing well services. And you can be really proactive in that allied health space in terms of exercise, managing chronic disease. And also I think we're seeing a real shift in people wanting to learn great self-management skills. So how do I manage my physical activity, my nutrition, my cognition? People want to stay healthy and active and well. So we have a range of obviously individual therapy services that people can access, but also then building into those group education classes, group exercise classes. This year we've also seen a number of wellness services move into the residential aged care space, which I'm particularly proud of, including exercise physiology groups, which are based around the resistance exercise. So I think we're really lucky that we can give our clients, whether they're 50 and very active in the community or a 90-year-old with dementia living in a residential aged care facility, that full scope of access to both individual and group therapy programs.
And why is reablement important, and how has it become such a big theme, especially this year? I think prior to this year, I hadn't even heard the term reablement. I understand that the concept and what you're trying to do for the older population is important, but reablement itself is taking on its own life, I guess.
Yeah, I think it's two things. I mean, I think the evidence has been gradually building with momentum, particularly over the last 10 or 15 years. I remember back when there were some reforms around 2013, the government started floating this concept of reablement under the Commonwealth Home Support Program, but I don't think the sector was quite ready for it then. But since then, we've seen real momentum build around research and evidence base, as we've heard again from the speakers today at the summit. So the evidence clearly shows that having a reablement focus for people, even when they're well or unwell, and all of those bits in between, is definitely the way to support people as they age. I think we've also seen a shift in expectations from the community. They want to stay at home longer and be more independent and be healthy, and they want the support for their family and friends. So we've seen that expectation and cultural and society sort of shift. And then thirdly, I think the big thing this year is that it's actually been embedded in the upcoming reforms. So, you know, I'm really excited by support at home and the corresponding changes in the quality standards for residential aged care as well, because I think it puts that real emphasis on that independence framework and supporting people as much as possible from a strengths-based approach to be healthy, eating well, you know, and getting the right support at the right time in the right place. You know, I think before sometimes the support was around, you know, being quite reactive. The reforms really give a lens on being proactive and getting our clinical teams working well with clients earlier in their journeys.
Tell me about your journey into aged care. You started as an OT. Did you go straight into aged care?
I had the typical public health service sort of career journey for the first 10 to 15 years, and then I sort of migrated to aged care. My first sort of aged care, I guess, clinical experience was in a community rehab setting. And one of the really nice things about community rehab is that it looks at an interprofessional approach to care, which lends itself really well to reablement. So it's not about whether you see a physio or an EP or an OT. It's about the person with the right skills at the right time seeing the client. And so when I was working community rehab clinically, we did a lot around what we call interprofessional competencies. So, you know, it wouldn't matter whether you were an OT, a physio or EP. If you had the skills to provide support in exercise or incontinence or mobility, you were the person that built that rapport with the client and help address that with the team's assistance. So then I moved into a large aged care provider in Queensland, again under Uniting Care banner called Blue Care. And I worked there for quite a while in an integrated care model as a leader and a manager there. And again, really saw the opportunity, I guess, for allied health, not only in community, but in residential aged care, and really starting to embed those reablement and wellness. And then shortly after that, I got the unique opportunity to lead a clinic called UQ Healthy Living. And it was a clinic specifically designed for healthy living practices for people over 50, a multidisciplinary clinic using the HER equipment, which is one of the sponsors today. Yes. So that was an amazing experience because that was really health preventative focused and really reablement and wellness. And it had this unique little twist of utilising students in an interprofessional framework for that. And so for me, that really bedded down the notion that, great care is great care delivered by great professionals, not great specific disciplines. Because if we work together as a team in aged care, wellness and reablement comes as second nature. We are all then focused around the client's journey and what the client wants to achieve. So then I spent some time in NDIS world, lots of learnings there, and I'm really excited about bringing that back to the allied health aged care space. And now I'm at Wesley Mission Queensland and I have the privilege of leading this very comprehensive multidisciplinary team.
What is it that keeps you in aged care? Because with your skill set, OTs are really hard to find. They're highly in demand across the industry now.
Yeah.
Why are you sticking with aged care? What do you love about it?
I just see the potential, I think. I think the profile of allied health sometimes in aged care is less than in other sectors. The allied health role is really acknowledged in acute settings. It's had obviously a big burst with NDIS focus in the last 5 years particularly. So I just see the potential, I think. I think also it's just really core to what we do as allied health and really core to what we do as an OT. Like my grounding as an OT is all about supporting independence and supporting someone's values and supporting the roles that they want to do. And so that's kind of core to my internal personal value set. And so, that's really what aged care is refocusing on now. Yeah. I think it maybe lost its way for a little while, but I see right now it's the opportunity and the potential with the reforms and the refocus on reablement and wellness that really, it just excites me. And, what I'm absolutely passionate about, no matter what sector or area that I'm working on, is providing great multidisciplinary care and great allied health teams as part of that. And I feel like the reform and the movement to those quality clinical standards is really going to put allied health back into the spotlight.
And why did you join Wesley Mission Queensland?
I think I love their values. I mean, I've had a very varied management and leadership career, and I'm really become more comfortable with my own personal value set and for that to align with the organisation that I'm working for. And Wesley Mission Queensland, at the core of everything that we do is our value set. So integrity, respect, compassion, empathy. And so that's pretty much my personal value set as well. I think also just it was this little hidden gem, like how many places actually have 8 allied health disciplines that are well-resourced, great centres, a really supportive senior leadership and executive team that at the core of what they want to do is to help residents in Southeast Queensland age well. So I think it was, those sort of key 2 or 3 drivers, the unique opportunity, the broad multidisciplinary skills set that was within the organisation, and the values alignment.
You know what was cool? 2 years ago, I was speaking to a general manager of residential who had a OT background as well.
Yeah.
And he was talking about the dynamic between, I guess, what we call reablement now versus the business model of aged care. Because if reablement is, on one hand, reablement is really trying to give them back their independence. But then if they're independent, will they need the nursing home anymore or the home care services? So there was that weird play at hand.
Yeah. Look, I think that's definitely been one of the constraints of the system. But I think it's also about how you stand back and approach it, even without the reforms. You can still have a holistic framework that puts the person at the centre of that process and helps them with their individual goals. And Wesley Mission Queensland does that really well as an organisation. Like if the person's at the centre of that, yes, we're constrained by our funding and our business models and everything, but if you're getting then the right support in at the right time, if that's your focus within the funding that's available to you.
Yeah.
But I think where a lot of people fall into the trap is letting the funding drive the outcomes. The outcomes should drive the funding.
Yeah.
So I think we need to flip the script. I think the reforms will really help with that. But, you know, I think it's also how you can stand back, look at it and try to be innovative, you know, and bring people on the journey for that care pathway. And also, how can you delegate that out across all different levels of your organisation? You know, one of the huge opportunities I see in the next 5 years is allied health working more closely in delegated care models. So supporting RNs and ENs on the floor to be focusing on wellness and reablement, you know, focusing on supporting care staff within home care packages to be supporting independence goals. Like you need a bottom, you know, top down and bottom up approach to get these, because it's a cultural shift in how we're delivering the care to individuals. And I think utilising sort of business model or funding frameworks is a little bit of a easy way to get out of having those conversations.
You talk about innovations and obviously a lot of exciting things in the next 5 years, a lot of innovations in aged care. Anything that you're seeing out there in allied health in particular? You mentioned Her Australia and the equipment.
Yeah.
Anything else that is exciting from an allied health perspective?
I think some places are playing a bit of catch up, like they're just getting to embedding some really great allied health programs. But the things that I've seen, you know, is looking at things like, how can we so we're doing a project at the moment around, we're going to start a project around podiatry care, where we're looking at upskilling some allied health assistants in a Cert 3 or 4 in podiatry care, so that we can use our podiatrists to do the specialist care, but use our allied health assistants to do more of the routine care. So I think things like that are super exciting, because we're not going to have enough allied health clinicians, as we won't have enough nurses. So the more that we can build the competencies of our care staff to support allied health goals, programs like that are super exciting.
It's impossible to find a podiatrist, so you
well,
want to
exactly.
free them up to
Apparently,
do the
only
course.
40 graduated from New South Wales last year. So,
really?
yeah, that's kind of, we're dire, right? So you've got to think outside of the box. Like, we can't keep saying that we're going to do things in the same way, because the resources aren't there. So we can talk about the funding and the systems constraints all day, but at the end of the day, if I don't have a podiatrist to see everyone on a 6-week routine schedule, then those conversations are null and void, you know what I mean? So I think, looking at delegated care models and looking at where allied health can, like the clinical partners in support at home, can work with care staff directly to build those competencies and support the client goals. I think that's a really exciting space, and there's a number of areas, you know, that can be applied: independence, functional skill building, exercise, you know, nutrition, you know, there's so much opportunity in that space. So I really want to, I know that's something I'm looking at with my team. It's part of our goals, but I, you know, really encourage the allied health sector and the care sector more generally to really embrace some innovation around that space. The other really big thing I think is around that preventative health kind of space. You know, there's some really great programs coming around healthy brains and good cognition and its relationship to exercise, and getting in front of that. Like, I think we've got really good evidence, and exercise is starting to become really well based in most care organisations now. But then adding in those extra elements around cognition, nutrition, self-management, you know, because we know that well-rounded healthy ageing programs, which cover all of those elements, and clients and residents and the community really want it. You know, they know that the key to staying fit and healthy and active is not only to be fit and healthy and active in an exercise sense, but in a brain sense, to know how to manage that, you know, eat well. We did recently, one of my big achievements this year is we started putting on some community sessions for the community, because we're placed right in the middle of our campus, right? So all the retirement living residents come, and then some of the residents from RAC come, and our dietitian just did a chat about the Mediterranean diet, you know, which is really evidence-based for great cognitive brain health. and just the response to that, like people are like, they're asking about, how much red wine can I drink and how much fish can I eat and how can I be like, the small Greek islands and the small, like there's this shift in this thirst for knowledge and being proactive about health.
Yeah.
Allied Health should grab that and really implement those multidisciplinary, multi-pronged approaches to health prevention, to keep people well. Yeah.
Got some questions from the sponsors.
Oh, yeah.
The sponsor is Aurelia Legal, an immigration law firm focusing on the aged care sector, specializing in navigating 482 and 186 visa sponsorships.
Hello, my name is Nilesh Bansal, founder and principal of Aurelia Legal. We specialize in helping aged care providers plan workforce strategies and assist them with visa applications for their staff. My question is, have you had any experience with sponsoring overseas workers on visas such as the 482 or the 186? And what are the considerations from both an employer as well as an employee's standpoint? Thank you.
Yeah. So yes, I have. And even just like 2 weeks ago, I was talking to a podiatrist from New Zealand who wants to come to Australia. So I think the really big thing for me, especially for the agencies and the recruiters, is spend some time with the applicants and make sure they're well grounded in what does the Australian system look like? What does residential aged care look like? What does community aged care look like? The reality of those roles, if it's a community role, you'll be spending a lot of the time in the car driving, or if it's a residential aged care role, you'll need to wear a uniform and, all of those sorts of things, because the way that our care system has been created and defined by the funding mechanisms is very different to other countries. And so an example of that, I was talking to this podiatrist the other day and, got a call from the recruiter/agency and they were like, oh, this person's really keen to work for you. And then I just arranged an informal chat for this person. And then when I got onto the chat, they knew nothing about our systems. They knew nothing about how podiatrists worked in Australia, and they knew nothing about my organisation. So all of the conversation then resulted in that. And I think agencies and recruiters need to really play a strong part in that. So then when an employee and an applicant connects, that you're connecting because there's already a desire to work in these spaces. I think for employers is not underestimating how big a transition it is for someone to move from another country to another system, particularly in my space from a clinical perspective, because funding drives so much of our clinical service model. It's not as easy as saying that your podiatry skills or your OT skills or your physio skills or nursing skills might transfer, but do they transfer into our context, and what support does the person need around that?
Yeah.
And also what support do they need around moving to another country or another city? They don't necessarily have friends, family, accommodation. So, I know that's really challenging in a not-for-profit. We can't always give big relocation assistance, but you can do little things, can I hook you up with my neighbour, or, where can I give you a map? Can we pick you up from the airport? Whatever it is, the informal support to help that transition, because that person will remember that, and it's just one less thing that they need to overcome.
No,
so,
absolutely.
So I think they're probably the key things from my perspective.
And the question from the other sponsor, so here's a question from Optimum Allied Health, a provider of choice for residential aged care facilities focused on quality of clinical care in their physiotherapy and allied health programs. The question is from Dane Mitchell, the Managing Director of Optimum Allied Health, and his question is,
Belinda, as an occupational therapist who's moved into leadership, what are the key traits or attitudes that you look for in a young professional that might indicate that they have the potential to step beyond clinical work and grow into a senior leadership role? And what it is about those qualities and attitudes that sets them apart from their peers?
I love this question, actually, because we recently recruited some OT graduates to our team. And it always takes you back to think whether those things that you look for now are the things that you demonstrated when you were at that stage of your career. So I was reflecting on the two lovely OTs that we recently hired, but more generally, because I've had a lot of experience with large-scale graduate programs. I think it's not about the technical OT skills. It's about the other skills. And is that person a well-rounded professional? Because right now, it doesn't matter where you work, residential aged care, community aged care, for a private allied health group, it doesn't matter where, you have to be flexible and adaptable. So, does that person demonstrate those skills to you? Have they had other life experience? Have they been able to maintain? Have they got a job whilst they've been at uni? What's that job been? Can they recognise that whatever work they have been doing at uni or in their other roles is transferable? So it's really about that professional skill set, time management, flexibility, adaptability. For me, I'm also looking for passion and that little bit of spark. Let's face it, right now, allied health graduates and OTs can get a job anywhere.
Yep.
That's not the problem.
Yeah.
But I want to know that if I'm going to invest time and opportunity and support into you, which I think all graduates should get, that you're going to respond with some great energy and some spark and passion. And you can see that in people. And I think a really great way to determine that, particularly in your recruitment processes, is just kind of ask them, like, why are they interested in the job? Is there something personal behind that? Have you had experience in this area before? I'll never forget, we've got this lovely EP grad who started with us this year. And his mum actually worked in our organisation. And that's how he got referred into the role for the recruitment. And his mum was a clinical nurse at one of our residential aged care facilities. And so I said, oh, look, why have you applied for a job at the place where your mum works? Thinking, he's a young guy, He was smart, he was good looking, he could have he looked like the sort of EP that would go to a sports EP practice, not someone that would want to work at an aged care organisation. And he's like, I've seen my mum working in this space and how much she cares for people, and I love it. And then he talked about how he'd helped this 65-year-old university professor in his student clinic get back from, a knee operation to playing footy or whatever, and he's like, I want to do that. I've seen my mum, I've seen these people in my student clinic. I can help them achieve what they want to achieve, and that should be my role. And I can't see that happening in other settings. And it was just that passion and that personal experience that he brought to that. Now, he maybe wasn't the most amazing clinician, to be honest, but I've noticed his growth over the last 6 months as he worked with us. The conversations he has with clients are amazing. So besides that passion and spark, it's the ability to be client-focused and build rapport. And I think if you can have that well-rounded professional flexibility, adaptability, and ability to connect with people, so much of that outweighs the technical side right now, because you have to have that to work well with an individual.
I love that. I love that story.
Yeah, it was
like
so
you said,
cool.
He could have sounds like a supermodel who could have worked anywhere else and worked maybe for a big football team or something, but it shows aged care.
Yeah. And he brought his personal experience to his passion, I think knowing what their value set is and knowing what drives them shows you whether it'll align to your space. And so much of what aged care is right now is values driven, and so I think it's really important to get graduates thinking about that, and is this the place they want to work? Yeah.
Another shout out again to Mark Ryu and the Australian Aging Agenda for choosing me as their content partner and reablement ambassador and providing the venue in which this podcast is taking place, which is smack bang in the middle of the inaugural Positive Aging Summit.
Beautiful Hilton.
In the beautiful Hilton in Adelaide, where everyone's gathered to speak about the importance of reablement. Now, the summit has just kicked off. What are you looking forward to?
I think just sharing experience. I think we're all on a journey at the moment. Really excited to hear about, some of that innovation we've already talked about and other people doing those things. So, as we said, her are here and, but also looking at some of these aging well programs and where the evidence is coming out. And workforce solutions to that as well, I think, because as we've acknowledged, there's not a whole bunch of nurses and allied health and care staff waiting to come into aged care. And I think learning how we can genuinely share these positive experiences and approaches, because like your podcast's title, we want to make aged care sexy, or at least give it a little spark and glamour.
Bring sexy back to
Yeah,
aged care.
bring sexy back. I love it at my age of life. Anything sexy is great.
Yeah.
So, but yeah, I think just having that ability to share those positive success stories and shine some light on that is really, really, really important headed into the next couple of years, and particularly the next 6 to 12 months with these support at home reforms.
And tell me about yourself now, outside of aged care, allied health, and work and career. What can we find you doing on the weekend?
Oh, at this stage of my life, running my children. I have 2 teenage boys, so
That's
we are
the real
very.
business.
That's a full-time career.
Yes.
So I have one in grade 12, so we're on the home stretch.
Ooh.
Just under 6 months to go. So I'm a soccer mum. I love being a soccer mum. I'm the vice president of the football support group at our school. Plus I manage a soccer team. And then my other son plays basketball and volleyball. So we're very fit and active family. So most of my energy goes there on the weekends, to be honest.
So you've got some vibes, basically.
Yeah. But I love it. I'm grieving at the moment because I feel like that window's shutting with my oldest, and he wants to go away to university next year, which I think is amazing. I want him to spread his wings.
For him,
but yeah, I'm a bit sad for me. So yeah, so just trying to enjoy that this year, to be honest, because I just want to. It's a point in time, right? Like anything. So I think you've got to grab that opportunity. And I saw this stat about something about you've spent 90% of your time with your children by the time they're 16. Now my oldest is turning 18 this year, so that's gone. And so grabbing those last bits of snippets of time with him, and then helping my other one transition the tricky nuances of grade 9 and 10. So so really that's probably between full-time work, full-time mum. Yeah, I have a partner in Sydney, so I do a lot of travel between Sydney and Brisbane. Love the beach, love hiking. And I still play netball. I'm very fit and active myself. So I've been playing.
I used to ref netball.
Yeah. So I've been playing netball with a bunch of girlfriends for 10 years.
Oh, you're an OT though. But
yeah.
I was thinking how your knees and ankles.
Oh, no, they're good.
The worst
yeah. Well,
rolling.
I have, and I also do a lot of strength training at the gym. The EPs and the physios watching this will be very happy to hear that. I think I could have been a power lifter in a former life. I'm a really big advocate for women, particularly in their 40s and 50s, doing resistance training.
Yeah.
And again, I think that's we're going to continue to see shift in expectations from clients over the next 10 to 20 years with that.
Do you want to share your numbers of the big 3 lifts?
Oh yeah, well, my PB, I just set a new PB for bench, which is 75 kilos.
That's huge.
Yeah, thanks. I'm actually super proud of that. And the really good thing is I'm gunning for my 18-year-old whose PB is 80. So I nearly got 77 and a half up this week, but not quite. So shout out to Drive Fitness in Brisbane. They're amazing. So my PB for deadlifting is 135, but I haven't done that for a little bit. Yeah. So they're the main 2. But I've been doing strength training for sort of the last 10 years and it's absolutely the key, right? And especially for ladies and especially for ladies that are aging, and I love it, I love seeing that shift actually culturally that women, middle-aged and, later age women now are wanting to shift weight.
Yeah.
And it's kind of becoming cool. And, I've got another OT colleague who's like chronicling her journey with strength training on the gram, and she's putting up her stats now. And my best friend from high school, she's going to the gym. So, and I've got friends now benching, and they're like texting me going, "Oh, I'm benching X kilos." So it's great, I think, because all of that's going to lead to where we need to go culturally in society with that aging well space.
You know what I love about powerlifting is it's not about the numbers that you lift. It's about you pushing yourself at your peak, that 135 kg versus 135.5.
Yeah.
The battle to get that extra
right
or lock out at the end.
Yeah.
It's all mental at that point.
Oh, 100%. And that's why I'm so stoked about my bench this year, because that I was on 65, 70 for about 5 years. And I've just pushed that over to 70, 75, 77 and a half now in the last 18 months. After 10 years of strength training.
Yeah.
So that's
the
motivating.
Discipline you had to go, the journey you had to go through.
Yeah. So I'm so excited. I'm like, my
I'm excited for you. That's
my
awesome.
18-year-old just lifted 80, and I'm like, I'm coming for you. I won't get him because next time he'll walk in the gym, he'll get 85.
Yeah.
But, you know, it's just being able to acknowledge how good it is for you and your body.
Yeah.
So, yeah.
Well, Belinda, thank you so much for jumping on the podcast.
Oh, no
really
worries.
Had a great
It's been
time
fun.
speaking with you. I really appreciate it.
Yeah, thank you. Cheers.
Thanks, guys.